This is an introduction presentation on Gallup Strengths for healthcare practitioners.
The strengths assessment helps to reveal your innate strengths. So the report that you've been given identifies what you naturally do best. It's been used by millions of students and professionals all over the world. So it is based on about 30 years of research in regards to what makes effective individuals, effective teams, and effective leaders. And it provides customised results that name your unique strengths. So the descriptions in the report do take into consideration the combination of strengths that you have. So it is a unique report to you.
The strengths assessment helps to reveal a couple of things for you: how you absorb, think, and analyze information and particular situations, how you actually make things happen, how you influence others, and how you build and nurture and improve your relationships.
There are actually 34 strengths that are revealed in the report, and they have guiding principles. So all themes are considered neutral and differences are considered to be an advantage. Themes are not labels, so let's not be tempted to label ourselves or others. And we lead with a positive intent. There's real mindfulness about not judging these 34 talent themes when they're identified, because it's really difficult to appreciate or assist somebody if you have a negative judgment. So I suppose here the guiding principle is no one is better than another. And the final one is, of course, people need one another. So if we have a look at the category, Gallup actually used 4 domains. Executing, how you get things done. Thinking is what kind of a thinker am I from a strategic point of view. And how do you influence, like individuals or groups? And what does it look like when you are relationship building? So also we have your top 5, which are your dominant themes. Probably from 6 to 15 are the supporting themes. And then right at the bottom, you've got your bottom 5, which can consider to be weaknesses because you will very rarely use these over a 12-month period. You use your top 5 daily. Okay, thanks, Manal.
So as was mentioned, the top 5 strengths are demonstrated in that report, and they are called your dominant talents. So these are the talents that you'll most often be using. And essentially with developing insight and awareness of these talents or strengths, you do end up creating more ease, excellence, and enjoyment in your experience, the more that you understand and then can utilize these strengths.
So whenever we have that feeling of flow, yearning, satisfaction, rapid learning, and glimpses of excellence, this means that we're actually tapping into our strengths. So we become more efficient, more confident, and we act with more direction and increase productivity.
So let's have a look at our talent, strength, and weaknesses definitions. So a talent is a natural way of thinking, feeling, or behaving. The strength is the ability to consistently produce a positive outcome through near perfect performance in a specific task. A weakness is a shortage or misapplication of talent, skill, or knowledge that causes problems for you or others. And often it will come in the form of a challenge, and Gallup will categorize it as balconies or basements. And it means that you're either overdoing something, that you're constantly doing it, that you're constantly in action, or that you're actually not doing what's required at all. And I'll just give a couple of examples so that you can understand. If you're behind the scenes motor mechanic and you never see the customer and you have little desire to contact people, that is not considered to be a lesser talent or a weakness. If you're a nurse who doesn't know how engines work, is that a lack of knowledge or weakness? No, not at all. If you're a receptionist who struggles to perform the basic steps of administering an injection, is that a shortage of skill or a weakness? No, of course that's not. But what if you're a motor mechanic who doesn't know how engines work, a nurse who struggles to perform the basic steps of administering an injection, and a receptionist who has little desire for contact with other people? Now, those are considered weaknesses in a role, and they're weaknesses that can be managed and coached. And I know both Manal and Carolina have some examples to share with you.
One example from my report is that I have empathy as my top strength. And in clinic working with patients, empathy can sometimes work in that basement or weakness category. I can sometimes end up taking on a patient's emotions. So it is obviously a strength where I can understand where a patient is coming from, but then when it works as a basement or a weakness, it actually means that I might be taking on their stress if they're feeling stressed and lose a little bit of perspective or clarity.
And I have achiever in my top 5. This means that I'm continuously looking to achieve and looking to creating good things and at a high level. But what that actually means is all those things that I create and I do well, I don't actually take a step back and enjoy what I've created. And that's where achiever can have a little bit of a weakness.
So an exercise that we do encourage you to do is to highlight all the words or phrases in each of those strengths descriptions within your report. So highlight words or phrases that resonate with you. And then the next step is to think of a time that you have demonstrated that strength. So think of examples from the past where that strength was really coming to play in the way that you were interacting or getting something done.
And then in that context, you can ask yourself, how might I better utilise each of my strengths for the current situation that I might find myself in or a future challenge? And are there any actions you could put into place to refine the use of this strength? And once again, in the reports, we can refer to the Action Planner Guide. And in there's lots of tips and actions to actually create ease, excellence, and enjoyment for you. And that'll be a clue that you're really on the way to developing your strength.
And another exercise we have that we'd like to encourage you to think about is writing your strengths there on the left and then having a think about how you will apply each of the strengths to define you as a practitioner, and then how you think you might watch for potential challenges that may arise with that strength. So Julie has an example with her individualisation.
Yes, as a practitioner, when I'm collecting information from clients, some clients are more private than others. Now, individualisation is interesting, is that it likes quirky information or it likes something that's unique to the individual. And sometimes it can be misconstrued either in a social setting or even with clients that I might be asking too personal a question. So I need to be really mindful of the person who's sitting in front of me and what their version or perspective of the questions that I'm asking. Because from my point of view, I'm just really interested in the person, but they may take offence. And so I have to be mindful of that. Creating a coaching circle, great opportunities here. So you can work on your own with the reports. However, it is really useful to be working with other people as well. And so you can create a coaching circle, probably from about 3 to 6 people is what we'd be looking at. And you're sharing your report, sharing your information, sharing challenges, and working out how does this look in action, and perhaps even partnering with people. And we know that we're in our strengths when we're experiencing ease, excitement, and enjoyment. And we enjoy, obviously, or we love what we do. So thanks everybody for listening, and we hope you get a great benefit from reading your reports.